AIM coaching call number 35. Um, I don't think everybody on the call has met me. I am Karen Ofafa. I'm the Vice President of Workforce and Clinical Excellence here at ASHA. I've been around for a little over 2 years, but my background is mainly workforce. But prior to that, I worked in the emergency room trauma one for a long time before I moved over to administration side of things. So as many of you know, Vicky retired. She's still supporting us, but she retired at the end of the year, and then Megan transitioned as well. So we are holding down the fort. I am going to pass it over to Larissa to introduce herself.
Thank you. Thank you. I am Larissa Solo, Manager of Workforce and Clinical Excellence here at ASHA. And my background is in nursing as well, with some telemetry and women infant services. And now I get to put some of that workforce and transition to practice in the in the history of my experience. So I am very happy to be here. I see Zara, I see a couple familiar faces. And so I will go ahead and pass the baton to Whitney, who is also on our team.
Hi, all. Nice to see you again. This is Whitney, and I am project support to our Workforce Clinical Excellence and Maternal Health team. Thanks so much.
Thank you, ladies. All right, we're going to go ahead and get started. Let me just share my screen. Larissa, let me know if I'm sharing the correct one. All right. Okay. So we're gonna go ahead and get started. Um, so I know we moved some of the calls, so thank you for being patient with us. I'm gonna read the acknowledgement here. Acknowledgement is simple, powerful way of showing respect. It's a step toward correcting the stories and practices that erase Indigenous peoples' history and culture. It's a move towards inviting and honoring truth. Truth and acknowledgement are critical to building mutual respect and the connection across all barriers of heritage and difference. We begin this effort by acknowledging what has been buried by honoring the truth. Every community owes its existence and vitality to generations from around the world who contributed their hopes, dreams, and energy to making the history that led this moment. Let us all take a moment to acknowledge the ancestral homelands of the tribe of Arizona. Today, I'm speaking from Phoenix and would like to recognize Otham and Peeposh, people who have stewarded this land since time immemorial. We pay respects to their elders, past and present. We're grateful and appreciative to those whose territory reside and work today. Larissa, take it away.
Mm-hmm. Yeah, so this is just our disclaimer slide about how these are intended for informational purposes only. Nothing provided by OSPA through this program is intended to be a substitute for professional medical advice, diagnosis, or treatment. All right, and agenda, I think it's back to you, Karen.
All right. So we're going to go through some ASHA updates, and then Larissa is going to review the data, the AIM data for the past quarter. We'll share some resources. I did want to share, especially for those new to this call, that we have a YouTube with all the AIM coaching calls that have been recorded. So we will share that in the chat at some point. So for the ASHA updates, we are super excited to welcome our new maternal health program director. And she is on the call today, Ms. Shannon Garcia. She's coming to us with over 30 years of progressive leadership experience in maternal and perinatal care. She has extensive leadership across OB, labor and delivery, couplet care, and level 2 nursery services. She's an active member of the ASHA AIM Steering Committee. She's an Arizona Perinatal Trust Surveyor. She's also certified in the Nurse Executive, the advanced one, and she's presented at regional and national conferences. Now, we would have loved her to start last week, but she's coming to us March 30th. So welcome, Shannon. We're so excited.
Thank you so much. I'm very excited to join. I'm looking forward to it. Thank you.
Awesome. And it will be good because Shannon has been on the other end, so she can really help us move and improve the program. So on your next AIM coaching call, Shannon will be here, so that'll be good. So just a few other things happening with us. We have OB simulation, and this is for it's obstetric emergencies in the emergency room. This training, we are partnered with Laredol, who's coming on site and doing the training. They're covering preeclampsia, postpartum hemorrhage, and maternal cord. If your facility has not signed up, please reach out. We will post the maternal health email on the chat. This is free, so it's not, it's through a funding that we have. And we have one source of funding ends May 30th, but we do have additional funding to continue this work for the next couple of years. So we would love to sign everybody up and use up all the money that's expiring in May. But for this training, really partner your ED and OB teams, and then all your pre-hospital or your pharmacists, your mid-level providers, flight crews, EMS, anybody who would participate in an obstetric emergency, you should invite them to this. So the way it works is when Laredol comes on site, they're running 2-hour sessions. So each person only has to attend for the 2 hours. And then they are running multiple of them. So they can do up to 4 a day. So if you have an ED with 28 people, they can get through all of them on that day. Each session can have 5 to 7 participants, and they make it work. Sometimes there's a facility next to you that's already participating, so they're able to just jump over and do that. Other questions that have come up are where do we want to hold this training? They want it to be in the environment where it's going to happen. So they would prefer for them to do this simulation in the ED, but if you can't tie up your ED or that's not possible, they have run it in a conference room. They've also run it, I want to say, up in OB as well. So just reach out to us and we will send you all the information. We'll get you connected. We have a kickoff call and they walk you through all the steps to ensure that you get this done. Any questions there? Okay. We're going to get into the AIM. So Larissa will cover the data. But we're just continuing to encourage and appreciate that you are collecting and submitting data for the hemorrhage bundle. And then with the mental health and substance use, as you're all aware, we are not running the full bundle for those. We're just focusing on the education pieces for those two. And right now we are capturing all your training in the last 2 years. So if any of those have already happened, please go and enter it in our Qualtrics. And then we will also post the link for where the AIM bundle resources are. I did want to point out that if you don't already have an assessment for the mental health one, we have some resources or some tools within the AIM bundle resources that we can post. And then I don't know that we've shared this year yet, but we do not have a AIM conference planned for this year. We are working it up to see if we can get it next year. This is because we've really expanded our reach. We used to do the AIM conference just in Phoenix, but we'd like to include all our rural and critical access, so we are working on that plan. I am going to pass the baton to Larissa.
Thank you. Yeah, so just taking a look at the state roll-up, this is what the third quarter looks like. And then let's go ahead and advance to the next slide. Thank you. Oh, there we go. Oh, one forward. There we go. So I'm just looking at how you guys increased to the fourth quarter. That goal is 100% with the hemorrhage cards. And then the goal is 80% with that the blood loss being measured, which is fantastic. And then we're almost to the goal for the hemorrhage risk assessment. So keep doing submitting all that data as well. And then the goal that we're looking for the debriefs is 50%. So you're exceeding that part of the goal as well. So that's looking good. We can go ahead and go to the next slide. So just wanted to review, this is where those dashboards are located on our website, specifically for the perinatal mental health and the substance use disorder in pregnancy. And so we have a link to our dashboard, but you guys can always reach out to us if you need that specific link on where to enter the data. And then next slide. Thank you. This is just to show you guys, right now we have approximately 11 facilities that have submitted the data for perinatal mental health and substance use for this year of 2026. And so out of those submissions, we're at 98% of that goal. And then the next slide will show us the percent goal of submissions of 94%. So continue submitting those. We appreciate that. And we'll start seeing those included in the infographic emails that will be coming up. And then next slide.
You can keep
And
going.
then- okay, sure. For those APAL trainings, we're going to be including that in the infographic emails as well. And so that is just the prescribers or non-prescribers taking those trainings. And so those are still open, and we have the link for that as well down at the bottom. That's that webinar series. So, and we can go ahead and advance.
Yeah. I am going to pause here if anybody has any questions on any of the things we've already covered. Any challenges with the site?
Will you be putting the links in the chat, or are you going to be able to send us the PowerPoint? Because it's hard for us to click on that link because
Yeah.
it's in a PowerPoint presentation.
We can put the links, all the links on the chat right before we finish this, but we also send out a newsletter, and those links will be there as well. But we'll put it on the chat before we end the call today. And I think Whitney might be doing that. Okay.
Mhm.
All right. Larissa.
So, yeah, just kind of reviewing some resources that we have, but some additional resources will be included in the newsletter as well. And the Institute of Reproductive Grief, they do have a webinar that's happening, and then they also have a screening tool. And we just wanted to share, they also have an annual symposium happening on March 27th, upcoming. You can attend in person or virtually. And again, that link will be shared with you guys. We can drop it on the chat and even include it if you guys reach out via email, anything like that. And then just that article at the bottom is that article that just talks about those missed stroke signs in pregnant women. And so those we can absolutely share with you as well. Any questions on resources?
I think on the last newsletter, we had shared like the APT conference that's coming up in June. So all those will be included in the newsletter. If you're not receiving the newsletter, please also let us know. Whitney would know how to get you back on that list. And then if we do not have the correct AIM contact person at your facility, we'd also love to know that. You can just post a new email or something on the chat, and then we can make sure you have that information. So today's call was not going to be very long because we were going to talk about the transitions and then share the data. We did not invite any speakers because we just have, we are managing the transitions right now. But if any of your hospitals would like to highlight what you're doing or share something with others, we welcome that as well. Send us an email so that we can share your story and then also bring you to the steering committee so you can share that. So I am going to go to the next slide. So this just shows the schedule. Our next call is May 19th, and Shannon will be here to help us with that. And then we have the 3 other calls for this year. Any questions about today? I know it was short, fast, and sweet. I'm going to stop sharing and just make sure we've posted all the resources on the chat. Let me see. Yep, Whitney has. Any questions on the OB simulation? Are you signed up? Do you want more information on that? We've also been hosting like informational sessions. So we have 2 recorded ones. We can certainly share those with you if you haven't seen or been part of it. Sanjona would like more information. Could you please post your email there? I know Whitney knows everybody, but I don't think I have your email. Okay, we can send it to you. Yeah. Perfect. Anyone else? I will send it to you right now. Yeah, and the OB sims are, like I mentioned, free to you. Obviously, you just need to pay for the time for the nurses to be there to experience the simulation, but the whole situation is free. And then Laredol comes in the day before just to set up the equipment, and they're able to move it around if needed, if that's occupying a room. Okay, I got yours too, Wanda. Yes. We have captured all of this. We will send, sounds good. Okay, got it. All right. If you all don't have any more questions, we're gonna give you some time back. The newsletter will be coming out with all the links also, and it has additional resources for you as well. All right, thank you all. Bye, have a good day.